and welcome to Arthritis and Osteoporosis, Western Australia. My name is Jennifer and I'm the manager here at AOWA. Well, we're delighted to have you along for this webinar, which of course is about COVID-19 and arthritis. And I'm sorry that we're not able to meet you in more favourable circumstances. We are indeed in unprecedented times. However, we have heard your call. We are receiving lots of questions at the moment from our consumers who have concerns about COVID-19 on a background of living with arthritis. So we've arranged this webinar for you so that you can get some information and some of the answers to the questions that you have been seeking. In a moment, I'll introduce Professor Hans Nossent, and he will be delivering a webinar to you. You'll be able to hear Hans and see his slides, and after the presentation is complete, there will be a Q&A time. We are still here for you. We're working very hard at the moment on a skeleton crew. We have stopped our face-to-face service delivery, and that's really so that we can take good care of you and not put your health at risk. But we really are still happy to be here to be able to assist you with your questions and your concerns about arthritis. We are the leading not-for-profit and charity in West Australia representing consumers' needs in arthritis and musculoskeletal conditions. So please do drop us an email or give us a call if you would like to touch base with us. For the moment, stay safe. I look forward to the day that I can see you all again in person when our services reopen in a face-to-face manner. I'll catch up with you again at the end of Professor Nossent's presentation, and we'll see you in the Q&A session. Enjoy the webinar.
Good afternoon, everyone, and thank you for attending this webinar, which is a new form of communication for me. My name is Hans Nossent. I'm the Professor of Rheumatology at UWA and a consultant in the Department of Rheumatology at Charles Gardner Hospital. And I was asked to talk to you a bit about COVID-19 infection currently ongoing and arthritis in general. Of course, these are very concerning times for everybody, and there's a lot of uncertainty connected to how this is going to play out. This is not particularly for patients with arthritis, but many people, of course, have similar concerns as people with arthritis. But I'll be hopefully showing you some details and data that can put your mind a bit at ease and indicate also where progress is hopefully being made in the near future in identifying ways to prevent and possibly treat the COVID infection, the pandemic that is ongoing. So while it may sound a bit odd, I have chosen to focus especially on patients with various types of arthritis that are using disease-modifying drugs for their treatment of their disease. And those are especially patients with rheumatoid type or psoriatic type or spondyloarthritis, and also connected tissue diseases like lupus vasculitis and other. And that is because patients with osteoarthrosis, which are of course the majority of patients with joint problems, are not particularly in the risk category for COVID, although they may have other risk factors such as age or comorbid conditions for catching the infection or getting a more severe infection. So I thought to talk a little bit about the virus itself and the role of the immune system, and then finally the balancing act that we always face in people with arthritic conditions and treatment for rheumatic conditions between infection risk and disease activity. If we start off with looking at the virus, can I change that? So virus is actually a Latin word, and it means poison, basically. So it gives a new meaning to the idea of something going viral on the internet nowadays, which is actually poisoning people's minds, probably. It's a name that's being used for now more than 5,000 different agents that are known to us. There are probably much more out there that we do not know about. The particular finding with these infectious agents are they're very, very small. They're like 100,000ths of an inch, and you can't really see them via a standard microscope. You need to have an electron microscope to visualize them. In addition to being very small, they're actually quite simple creatures. They have a very simple buildup, and they lack all the necessary tools to produce energy and to produce proteins. So in that way, they actually can be considered as parasites because they prey on living cells to provide the energy and the protein synthesis for them to stay alive. And they can do this by invading animals or plants or bacteria even, and of course also humans. There's an ongoing more academic discussion if these are true organisms, because actually they are not considered to be free living, but that's more of an academic discussion than very relevant to this discussion. If we look at a picture of a virus, then you can see that what's called a virion is the full particle that constitutes a virus particle. This is a transversal cut through a virus, which could be a coronavirus, could be a different type virus. All of them share their similarities. And the actual infectious part of the virion is the nucleic acid that is contained within its core. That could be RNA for RNA viruses like the coronavirus, or DNA for other types of viruses. And that is the truly infectious part. And the virus is very clever because it's actually protected this infectious part by two layers. One is an inner shell that protects directly the RNA and the DNA from degradation. And then there's an outer shell that also protects the inner shell, but also leads to attachment of the virus to host cells and possible penetration as well through their like small feet that they have on their surface. And that's the full virion, and that's typical what you see in the coronavirus as well. The full particle looks like this, and already a number of proteins have been identified on the surface of the virus, which is helpful in thinking about and creating potential mechanisms of interfering with the way the virus attaches to the surface of host cells. It's been done successfully for other types of virus infections like hepatitis C, of course for the AIDS virus as well. And this is one of the ways that possibly the COVID virus may be treated in the near future. So if you get a viral infection, it doesn't always mean that you get ill, you get sick. And that's possibly related to the way the viruses enter your body. There's no clear certainty how that works. Because we know that many viruses actually enter our body and lie dormant in our tissues without ever causing illness, unless there are certain circumstances that may trigger that. So shingles, for example, or cold sores, all triggered by herpes viruses that are already in our system and suddenly seem to be able to replicate under certain conditions. Other viruses like the hepatitis B and C viruses that are entering our body settle down in the liver and there cause low-grade inflammation that after 10, 20, 30 years can cause damage to the liver. And some of the viruses actually are so clever that they are able to become integrated into our own DNA, our genome. And that, for example, happens with the development of cervix cancer due to the human papillomaviruses. Coronavirus COVID-19 is different because it actually directly causes inflammation of the upper airways. And that can, of course, be mild to severe. The way in for COVID virus is easy. That's only one way in. Basically, that's through the upper airways, where it will try to attach to the mucosal lining of the airways and try to invade these cells as well. Of course, this implies directly that if you want to prevent COVID-19 infection, that's where all the measures for coronavirus prevention come into play. You don't want these virus particles to attach to your mucosal lining of the airways and start multiplying there. So that's avoidance, that's keeping clean, that's using disinfectants and being aware if symptoms would occur. So this is key for everyone, not only for people with arthritis or people with arthritis using immune modulating drugs, but it's important because this is the way you can avoid catching it. And it's important to realize that people with various types of arthritis are not necessarily prone to catch it more easily. They are more at risk for severe disease development if they catch it. And that's why the corona prevention is so uppermost in all recommendations. And that's why all our lives are being disturbed to try and prevent further infections from occurring. So this is all familiar to you, the social distancing, which disrupts all our lives, and the attention to personal hygiene with all the standard recommendations that you've been reading and hearing about for the last few weeks. And importantly also to the last point, which is something that I didn't realize that well, is cleaning your phone regularly, computer and work services as well. Of course, many people will be working from home and using electronic devices. For the whole world and for Western Australia and Australia, prevention is key for everything. And that's because of this slide that is taken from the CDC in the US. If you have a pandemic and you're let it go its own way, like possibly happened with the Spanish flu 100 years ago, then you will get an enormous peak of people falling ill, a number of people passing away because of the illnesses, but that will settle down in a few months because there's more people acquiring immunity and the spread of the virus is slowly contained. However, this purple peak that you're seeing is something that completely overwhelms all our potential hospital and healthcare resources that we currently have available. So the whole idea behind the social distancing and the prevention is to not let the pandemic numbers go above this critical line of what we can achieve in terms of healthcare and helping people that fall ill in a severe manner. And that's important because currently about 2,100 people who develop the coronavirus infection develop severe lung disease. And if we would have 100,000 people infected in WA, about 20,000 would need hospital admission in a short period of time. And in best case scenario, we currently have about 3,500 beds available. So that's all just to illustrate how important it is to prevent this pandemic from reaching that high peak and trying to slowly taper down the number of cases. But then, if you're unlucky and you do catch the COVID virus because some people may be carriers, not have any symptoms, and you're not aware until you've developed some symptoms, then the COVID virus will invade your upper airways. It will attach itself to the mucus-producing lining cells of your upper airways especially. It will enter the cells. It will make the cells basically start reproducing the virus DNA instead of its own DNA. The cell's own DNA and protein synthesis gets disrupted, and more virus particles are being produced. And in the end, the virus particles that have been produced will leave the cell again, and they leave behind a very damaged cell, which again increases the risk for secondary bacterial infections. So the consequences of the COVID virus infection, most people will be flu-like syndrome, which can be mild to a bit more severe. And in about 20% of people, it may become so severe that significant lung disease occurs. You can see the significant whitish areas in the lungs that indicate severe inflammation. And that occurs in about 20% based on current statistics. The one thing that decides to a large extent what is flu symptoms and what becomes more severe disease is our immune system. The immune system for patients, especially taking anti-rheumatic drugs, is different. There's no doubt about that. There, the immune system is different, functions in a different manner, because in most autoimmune disease, it's firstly overactive, and we try to balance the overactivity with medications to to get the balance back, but it's hard to decide if the balance is completely where it should be or if you're more immune suppressed than you should be. Reduction in the immune system is, of course, partly age decided. There's a process called immunosenescence. As we age, our immune system becomes less active. And then there's a range of medications and concomitant diseases like heart and lung abnormalities that also reduce the immune system's function and the risk, increase the risk that you get severe disease. We're currently not aware if the numbers of patients that take anti-rheumatic drugs for various types of arthritis and related conditions developing severe disease is higher than the 20% in the other populations. There's currently a new initiative where there's global worldwide registry that's online, where we'll be entering all the data for all the patients with rheumatic disease that develop COVID infections, so that we can have an idea how big the risk increase actually is if you take these conditions. Of course, currently that's unclear. This is a bit of a dangerous slide because I've listed here most of the anti-rheumatic drugs, and I've on the other side, on the right side, listed relative immune suppression that follows with these medications. This is not science. This is a kind of consensus amongst most rheumatologists to the extent of which each drug actually reduces the immune system's functioning. However, there's no absolute numbers that can be connected to this. And there's the other factor, that is that some of these drugs, especially hydroxychloroquine and also tocilizumab, are actually being trialed as medications to treat the COVID infections. So they may actually be rebalancing the immune system more than anything else. So the question often is posed then, is it better to stop my medication just to be sure? And the short answer is basically no. If you have the next one. There's no evidence that stopping your medication will help. And the only evidence that we have available at this stage is that patients using immunosuppressive treatments have not been found to be more prone to die from a severe lung infection. But that's, of course, not a big reassurance, but you can get pretty ill, but the mortality rate does not seem to be increased. And there's absolutely no evidence that if you feel well while on your treatment and you're not having any fevers or signs of infection, then you should not stop your medication. And this is the whole list of medication that can be continued according to all current advice from coordinating bodies in worldwide. Especially steroids should not be stopped suddenly, because that can cause significant problems. So better not to stop your medication. And the other reason for that is that this pandemic may last for another 6 months, 12 months, nobody really knows. So if you stop your medication, the risk is of having a severe disease flare is quite significant. That would then entail often more aggressive treatment than you're currently on, as often with high-dose steroids, and that's a bigger risk factor for getting severe COVID infection than being well controlled with medication. So nobody currently advises stopping your medication. We know that if you are taking some of these anti-rheumatic drugs and you have other risk factors for COVID, or you've had a recent history of recurrent infection, then prevention, especially isolation, is important. You don't want to catch it if you have already a tendency to infection. And if you're on the medication and somebody nearby in the family, friends, has a confirmed infection, you've been in touch, discuss with your rheumatologist about possibly delaying or changing a dose for a while, similar to with any other infection. That's current advice. What can we do in the meantime, other than wait until this whole thing blows over, as it will in time, but nobody knows what the final outcome will be. It's important, if possible, to keep your vaccinations up to date. So flu vaccination still recommended. Possibly, if you haven't had one, a pneumococcal vaccination as well, to prevent severe secondary bacterial infection. There's no need to worry much about your medicine supply. There's been some discussion about shortages, but currently there are measures in place to ensure that patients with rheumatic diseases will get the medications they need for approved indications. Some pharmacies are now asking for letters to confirm that, and your GP or your rheumatologist department should be able to provide that as well. Given the fact that the supply seems more than sufficient, the advice is not to stock your medication for more than a few months at a time. Keeping appointments is not easy these days, especially if you're using a biological or a JAK inhibitor medication. But nowadays you can do this with the phone. That's all been approved by Medicare. So a review via the phone or telehealth is considered sufficient evidence for continuation of these medications. If you need blood tests done, there is now also, and you're in self-isolation or need to isolate, then you can get Medicare rebates available for have bloods collected at home as well. And finally, if you do feel that you may be catching the COVID-19 infection based on the symptoms of a new onset of coughing, fevers, being more severe tired, nowadays a sore throat, and possibly a loss of sense of smell as well. And of course, if you get more short of breath, then that are symptoms that you need to get medical attention. Call your GP or the COVID hotline for advice, especially. Make sure you have the medical history and your drug treatment on hand as well. Get advice about being tested if and where, and remain at home until you have all the results in and have received further medical advice. And as said, most people will actually have a mild disease course, even if you have an underlying rheumatic condition and are taking some of our strong medication. So stay safe in the meantime and stay well. And if needed, we'll be back with an update at some time point. Thank you.
Depends very much on the severity of the disease, the type of drug that you're taking. Some of the drugs will have a long-lasting effect. Some of the drugs have only a short-lasting effect. So there's a lot of variables there that are very difficult to answer without having any more specific information. The drug hydroxychloroquine, which many patients use, has a long-lasting effect that lasts for about 2 to 3 months, even if you stop taking the medication. But then that medication may be beneficial if you have a COVID-19 infection. The other drugs, a short holiday wouldn't hurt too much, I think, which we often do around surgeries or other infections. But given the fact that this may last for up to 6 months, there's a significant risk that disease flares occur, and then you'd be in trouble by wondering how you would get patients back to a lower disease activity state. For example, by using high-dose corticosteroids, which again increase the risk of severe infection. So there's no easy answer to that. Patients often have very clear ideas, experience of how things work out if they take a break from medication. And I would go by that. And if unclear, if you're uncertain, call the rheumatologist and discuss the case.
Okay, great. Thank you for that answer. Just for everybody that's watching, this is the first time that we have engaged in a webinar or Q&A sessions like this, so there will be a little bit of teething problems. Please bear with us while we get used to the technology. We are hoping to put more and more of our services available to you online during this period that we can't do face-to-face delivery of our services, and we'll keep you informed about those. Now back to the Q&A session. I've had a question, same question from a number of people. They've heard in the media that taking drugs that are designed to treat rheumatic disease might actually provide some protection and benefit for COVID-19. I'm wondering if you can comment about that.
The evidence for hydroxychloroquine, for example, in reducing COVID-19 infection severity is quite limited. There's been a trial of 20 patients with and 20 patients without the medication. And patients of the medication had lower, what's called viral load, so number of variants in the blood than patients not being on that medication. In one short study in France, it also led to a shorter recovery period. That's current status, and I know that some of the other rheumatic disease medications like tocilizumab, Actemra, have been used in patients with severe disease to try and reduce the severity of the lung inflammation. But that's about the status of it, and that's why the initiative is there to collect as much data as we can from all rheumatic patients around the world that are possibly infected with COVID-19.
Thank you. Now, for the people that are viewing, you will probably have noted that Professor Nossent and myself are seated at a fair physical distance apart, and that's because we're practicing safe physical distancing on a background of COVID-19. Now, I have had a question from a consumer that has asked about how she might best choose to self-isolate as a family when there are family members living in the home that are at particular risk because they are taking immunosuppressant medications.
If there is nobody that is unwell, then the self-isolation doesn't need to be very strict, other than staying at home and trying not to get too close to other people that may carry the virus. The situation is of course completely different if there's somebody in the house that has possible airway infection, possibly COVID infection as well. Then you would need to basically completely isolate that person in a separate room, use separate tools for eating, sleeping, etc. So it's very much dependent on the situation of the individuals in the house. If everybody is doing well, not showing any signs of infection, then there's no need to further worry about distancing.
Thank you. Next question has come from somebody with osteoarthritis on a background of rheumatoid arthritis, and they have recently had a knee replacement and they stopped their Humira injections prior to surgery and now need to engage in rehabilitation. And they're concerned about that contact and physical distance that's involved in rehabilitation and have asked how they can best manage their situation.
That's an extremely difficult question to answer. The standard advice would be to go back on the medication after the surgery and maintain as much social distancing as possible during rehabilitation, which is of course easier said than done. But there's this balance between getting rehabilitation benefit as fully as possible and trying to avoid possible COVID infection.
Okay, now I also have another question. This again has been quite a popular topic, and it's around the use of non-steroidal anti-inflammatory drugs. So there was some information in the media last week that had linked worse outcomes of COVID-19 with NSAIDs. And so people are asking, particularly when they're in pain and they're using NSAIDs as pain medication, what should they do? And they were also interested to know whether the information around NSAIDs was fake news.
The evidence isn't that great. What I've read and heard about it, it's very sketchy, and I wouldn't be able to explain it on a theoretical basis as to why NSAID use would lead to a poor outcome overall. The view has been expressed by many others as well, so I think there's no need to be too worried about NSAID use at this stage.
Thank you. Next question I have is from a pregnant lady with rheumatoid arthritis, and she was taking an Enbrel. And she's currently taking no medication while she's in pregnancy-related remission. And she's looking for some advice as to how she continues with her medications after baby is born, particularly as baby is likely to be born in the middle of a global pandemic of COVID-19.
If she's in a correct remission during pregnancy, then there's a good chance that it may last longer. The postpartum period is a risk period for a disease flare, but half of the patients will maintain disease remission for longer than that. So there's every chance you may want to be able to stay off the medication for as long as possible, basically. That would be the general advice.
Thank you. I've also had some questions from health professionals who are taking immunosuppressive medications, and they're wondering if there's any practical tips or any particular special precautions that they should be taking whilst they're managing the care of their patients and they're at an increased risk themselves.
It all boils down to prevention, I think. Having a condition or using immunosuppressive medication is not necessarily an increased risk factor for catching the virus. It's increased severity that you're worried about if you catch the virus. So prevention is key here as well.
Thank you. Now, I've had a question about exercise, and probably I'll take that one myself. The person that's written in here has said that they really enjoy pool exercise, bike riding, and that it's really important for them because it helps to manage their arthritis, and now they're self-isolating, they're a little bit at a loss to know what to do. Well, the good news is that there is so much you can be doing in the home. We're just getting online with our services now. We're hoping that by next week we'll have videos up for you to join into. We'll also be offering some live streaming of exercise classes that you'll be able to dive into, and we are going to be offering those to you for free, at least for the next 4 weeks. So watch this space, and in the meantime there is hope you can exercise at home. There's absolutely no reason why you can't. So watch this space. Have a look on the YouTube and see if you can find some exercises to do while you're waiting for us to upload exercises that are specifically designed for people with problems related to arthritis. I have another question here. It's from a health professional, and I'd like to put this one to you, Professor Nossent. People were just health professionals are just asking about the best advice that they can give to patients who are taking immunosuppressant drugs. Just general advice, what reassurance and what good advice can they be giving people?
So, prevention. Keeping their distance, make sure they're not near people that have upper airway infections, people that have traveled. Basically continue the medication as long as they stay well with the medication. And if they start showing symptoms of an upper airway infection, that's the point where you would want to get tested and possible confirmation of a COVID infection, and then that will probably indicate hospital care.
Another popular question is around immunity, and people are asking that if they are to contract COVID-19 and have a good outcome, are they developing immunity in the meantime?
It looks that way at the moment, so the evidence seems to be that the virus isn't mutating in a large which means that once you've had the viral infection, you're probably immune for a good number of years. However, it's very early days still, so we don't have enough data on how many people have recovered, how well they have recovered, how their antibody levels are, and how well they maintain antibody levels over time. But that's the current thinking is that it may be protection for at least a few years.
Okay, well, we've had so many questions. We've tried to pick the most popular questions to put to Professor Nossent today. I'm really sorry that we can't answer them all. There just isn't enough hours in the day, but thank you so much to all of you who sent questions in. There's clearly a thirst for information around arthritis and also arthritis and the background of COVID-19 pandemic that we're seeing. We will be releasing more information as the story unfolds, and also more information and more videos to keep you busy whilst you might be at home and to keep you updated. I'd like to thank Professor Nossent for giving his time very generously today and to come and share his expertise with us and to help answer your questions. We're very appreciative of that. Thank you. And if you have questions at home, we are working on a reduced service here at AOWA. Staff at this stage are still in the building. If we do go to a situation where we are no longer going to be safe to continue to work in the building, we will still be working from home. So please do send your emails into us. And in the meantime, stay safe. Stay active where possible and stay healthy. Thank you. Bye-bye.